We're joined now by Dr. Matthew Robinson, and he's the Medical Director of Infectious Diseases at St. David's South Austin Medical Center. Doctor, thank you so much for joining us today.
Hi, Quita. Thanks for having me. Glad to be here.
Well, with Omicron now here in the Austin area, how soon could we see a new wave of COVID-19 cases, or are we already seeing that wave right now?
Sure. Well, I think we're seeing some increased testing, increased positive results of testing locally, and so I think we're beginning to see what is most likely, going to be a surge here locally. I think in terms of how soon, it's difficult to say, but I would estimate sometime in the next 2 to 3 weeks we may see some sharp, uptick in positive cases here locally.
Well, doctor, are you advising any of your patients to maybe reconsider their holiday travel plans or plans to get together with family and friends for the holiday?
Sure. Well, not necessarily advising not to do that, but just, again, be aware of the risks. And, I think we are going to begin to see increasing activity of virus here locally. And so be aware of your own health risks of those in your orbit that are going to be in your home who may be joining with you during the holidays. And, I don't think it's a reason necessarily to not congregate, but I think this is a place where testing can be utilized. You can do rapid testing through local clinics or pharmacies, or at-home tests is what we'll be using. Actually, is testing day before gathering. And I think if you're not feeling well, don't attend. And then the good old-fashioned so-called non-pharmaceutical interventions such as masking and distancing will still work. Fortunately, we're going to be enjoying some great weather, warm weather here for Christmas locally in the Austin area. So, consider having your gathering outdoors. That will also help reduce potential transmission.
Well, doctor, this is a question a lot of people have been wondering about. Are vaccines working against Omicron?
Yeah, yes is the short answer. It's still the best way to protect you and those around you. And, we do see breakthrough infections. We've seen that with other variants, not just Omicron, but still seems to be the best way to prevent serious illness, hospitalization, and deaths. It has a strong track record of reducing transmission as well. Now, we're still gathering data with the Omicron variant, but I would still strongly recommend those who are unvaccinated or undervaccinated to complete that process, because it will still be a benefit and provide a level of protection.
Doctor, are treatments such as Regeneron working for patients infected with the Omicron variant?
Well, that particular product seems to have reduced activity for this particular variant. There are several monoclonal antibody products available, and at least a couple of them probably have reduced activity for this variant. There is another one that seems to have preserved activity. So there are options, and again, much of this data is still being generated. But with any new variant, there are potential changes in what may be effective therapy and protection, and what may not be.
All right, lots of good information. Thank you so much, Dr. Robinson, and thank you again for being with us.